Hello, my name's Tyler Dawson. Today we're going to be performing an abdominal exam. So if I could, if you would please lay back with your hands to your side, we'll get the exam started, okay? Just going to lift up your shirt here, expose your abdominal region here, expose your waistline. Okay. Just doing a general overview exam, just take a quick visual look at your abdomen here. Your abdomen is symmetrical, slightly rounded in contour. Umbilicus is inverted without bulging or discharge. Skin is smooth, uniform in color. No visible scars, no striae, rashes, or visible lesions. Taking a look for any sort of abnormal pulses or movements of the abdomen. No visible pulsation, paracelsus, or visual distension. Next, we'll move on to auscultation. First, what we'll do is we'll take a listen to your left lower quadrant here. Dial sounds active in left lower quadrant. We'll move up to the left upper quadrant. Dial sounds active in left upper quadrant. We'll move over to the right upper quadrant. Dial sounds active in right upper quadrant. We'll move down to the right lower quadrant. Dial sounds active in the right lower quadrant. Next, we will take a listen for any sort of friction rubs over the liver. No audible friction rubs over the liver. We'll move over to the spleen. No audible friction rubs over the spleen. Next, we'll take a listen for bruits using the bell of the stethoscope. That one's electronic, so we'll still use the diaphragm. We'll take a listen for bruits over your aorta. No audible bruits. We'll move to the right renal artery. No audible bruits. We'll move over to the left renal artery. No audible bruits. We'll move down to the left iliac artery, the right iliac artery. No audible bruits. We'll move over to the left iliac artery. No audible bruits. We'll move down to the right femoral artery. No audible bruits. We'll move down to the left femoral artery. No audible bruits. Next, we'll put our stethoscope over the umbilicus and take a listen for venous hums. No venous hums present. Okay. Next, we'll do a general percussion for tympani in all areas. We're looking for tympanic resonance in all quadrants, as well as the abdomen, the liver and spleen. First, we'll start by percussing the liver span. I'm going to move up here to the right midclavicular line and move down till I hear an area of dullness, which is just about here. We'll go ahead and mark this spot. I'm going to move down. I'm going to move up toward the right midclavicular line again till I hear an area of dullness. About right there. We'll mark this. Take a tape measure here and get those two spots measured. Looking for a distance of 6 to 12 centimeters. We're looking right at 6 centimeters, so that is normal and expected finding. Next, we'll palpate the spleen, or percuss the spleen, excuse me. Okay. Tympanic resonance. Now, what I want you to do is I'd like you to take a deep breath in for me and hold it. Tympani remains. Do you feel any pressure or pain when I do that? Okay. Next, we're going to percuss the right upper quadrant, right lower quadrant, left lower quadrant, left upper quadrant. Tympani remains in all sides. Next, we're just going to do a general inspection of for ascites. Doesn't look like you have any, but we'll just do this for general show. I'm going to percuss randomly downward. Now what I'd like you to do is tilt your hips over to your left, please. We'll do the same thing in the same areas. No ascites present, no areas of dullness that changed with the tilting, so that means that you do not have any sort of ascites going on. Next, we'll just do some palpation. First, we'll do some light palpation in the right upper quadrant. Tell me if you feel any pain. Left upper quadrant. Left lower quadrant. Right lower quadrant. Okay. A little bit more pressure this time. Right upper quadrant. Left upper quadrant. Left lower quadrant. Right lower quadrant. Okay. No masses or organ-megaly. Patient denies tenderness, which is an expected finding. Next, we're going to palpate your liver, okay? So I want you to go underneath your sternal border here in the right midclavicular line. Any pain or tenderness? No. Okay. Next, what I'm going to do is ask you to, we're going to test for a Murphy's sign, which tests for cholecystitis. So what I'd like you to do is take a big deep breath in for me. Feel any pain or tenderness? Okay, very good. Next, what we're going to do is palpate the spleen over here, okay? So we'll kind of do a similar thing over here, okay? Take a big deep breath in for me. Very good. Any pain or tenderness? No organ-megaly. Spleen is not palpable. Liver is not palpable. Liver edge is not palpable. Next, we're going to palpate your kidneys, okay? So what I'd like you to do is tell me if you're feeling any pain. Can you take a deep breath in for me? Very good. Do the same thing over here on this side. Take a big deep breath in for me. Any pain? No. Very good. Kidneys are not palpable. Patient states no tenderness, which is a normal finding. Next, we will do a few special tests here. What I would like you to do, first thing, these tests check for appendicitis. So what we're going to do, we're going to first do a test called the Rosen sign. What we're looking for is rebound tenderness in the opposite quadrant. So what I'm going to do, just below the umbilicus here in the left lower quadrant, I'm going to apply some pressure, and I'm going to release, and tell me if you feel any pain in your left or right lower quadrants. Okay, you ready? Any pain? No. Where'd you feel the most pressure? Left lower quadrant. So no rebound pain. So that's a negative sign for appendicitis. We'll do another test called the Soasa sign. So what I would like you to do is, I'm going to put my hand on your thigh here, okay? What I'd like you to do is try to raise your right leg for me, okay, against my resistance. Okay, very good. Did you feel any pain? No. Okay, very good. So that is a negative sign for appendicitis as well. Next, we are going to do the obturator sign. So what I'm going to do is I'm going to do a passive right leg raise here, and I'm going to tilt your pelvis inward, and I'd like you to tell me if you feel any pain.
No.
Okay, very good. That test is negative, which indicates all three signs, negative for appendicitis, which is very good. Next, what I'd like you to do is I'd like you to sit up for me. We're going to do a test of the costovertebral angle tenderness. This is a test for your kidneys, okay? And what you can do for me here is if you could turn to your right. All right, very good. And this is going to be kind of a percussion test. And we're going to kind of go right below mid here, okay? I'm going to do this bilaterally with a fit and I'm going to percuss rather hard, okay? You tell me if you feel any pain.
No.
Okay, very good. CVA tenderness is negative. I believe that concludes our abdominal exam. Thank you very much.